It's not something people like to talk about, but what does being regular actually mean when it comes to your digestive health? We spoke with the specialist at Advanced Gastroenterology and Surgery Associates about when it's time to see a specialist.
If someone has chronic abdominal pain associated with changes in bowel habits, and it's been going on at least 3 times for the past 6 months to a year, then you can, by what's called the Rome criteria, diagnose them with irritable bowel syndrome. Now, of course, these are patients without warning signs, meaning no weight loss, no poor appetite, no blood in the stool. And it can be divided into diarrhea predominant, meaning that the patients mainly have diarrheal symptoms, or they can be constipation predominant, where patients have mainly constipation, or you can have both, alternating constipation and diarrhea. But it has to be abdominal pain associated with changes in bowel movements.
Usually by the time patients come to the subspecialist, such as gastroenterologists, basic labs have already been done, perhaps radiology, radiographic studies may have already been done, such as a CAT scan. So if those are done and do studies, for example, in patients with diarrhea and so forth, if they of course, if they review an upper GI source, we go down and we do an upper endoscopy. If they review a colon source, then we do the lower endoscopy. But if those are non-specific, then we do further testing.
Irritable bowel syndrome is a chronic condition. The most common reason that we actually see a lot of patients, maybe outside of acid reflux. The one good thing about irritable bowel syndrome that I tell patients is that it won't kill you. You may feel as though you're dying, but you're not. There are many various things that potentially could cause it. Stress, like we mentioned before, patients usually have more stressful situations when they get their symptoms. There is an entity of post-enteric irritable bowel where patients who've had any gastrointestinal illness may develop symptoms of irritable bowel. The symptoms may linger. They may get better, but linger a little bit longer than they normally do. So a lot of patients after an event, we know that something triggers it. It could be virus, could be bacteria, could be a food toxin, but it triggers this abdominal pain with changes in motility of the bowels, and in the majority of patients can be sort of chronic.
We've included a link to what your bowel movements are telling you, along with more information on the treatment and surgical procedures available at AGSA under the Healthy Bowels Story link on our homepage, yourhometownhealth.com.